I think that oncology is an exciting field where there seems to be new drugs every day. And we used to give chemotherapy that kills the tumor cells, the cancer cells, as well as the normal cells with a lot of toxicity. But now we have targeted therapies as we know more about the science and molecular mechanisms behind different pathways. And I was a molecular biologist as an undergrad at UCLA, and that kind of also doing some immunology research. And that I think the combination of the science and the patient care is really exciting in the field of oncology.
I've been 18 years, so I've been through a lot. I've gone through a lot of the drugs. So we're getting at a point where we have to keep on trying new things to help me. I had a very severe episode about 2 years ago, and my wife kind of researched, and Dr. Wang came up a couple of times. He was willing to learn about my disease. He had the knowledge of the disease, but he was willing to investigate what I needed for me. And I think one of the things that has caused me to have longevity is not just the fact that my wife will get me to the right place at the right time, but I'm willing to do it. And that's the key. I talk to people and they're afraid, and I want to make my decision. No, Dr. Wang says, Fred, we want to do this, and we do it. I say we because, she fights with me, so everything is we. And I think that helps. You can't hesitate with cancer, in my eyes. So I think that's what's kept me alive. We researched him. We know he's a good doctor, so we don't have to do that again. Just believe he's a good doctor because he is. And I think that confidence. And when he suggests something, not that you shouldn't get a second opinion maybe sometimes, but trust him. He's out for the patient. He will give you the test necessary, never hesitates to give you tests, which a lot of doctors do for some reason or another. I don't know whether it's insurances or this or that. But when he says, Fred, I think you should do this, we do it.
A majority of cancer that metastasize, we still cannot cure. But what the difference is now we can offer patient quality of life with less toxic drug, as well as better drugs that prevent the cancer from growing or stop it from spreading. And even though we may not be able to get rid of it completely in majority of cases, but we can make it a chronic disease. Sometimes a pill is all it takes to keep the cancer at bay for a very, very long time. I think oncology is a perfect mix between the science as well as patient care. I think oncologists have a special place in oncology patients who are in most desperate need for medical care and support. So as I rotate through different rotations during residency, it was an immediate choice that oncology is the place where I'll feel most satisfied. I'm very happy that I choose oncology. I can't imagine doing anything else.